We are so excited to be here at Health 2.0 Conference USA 2023, Las Vegas, Nevada. Please introduce yourself and the organization you're representing today.
So my name is Taylor Hooker, and I currently work as a health system specialist for the Department of Veterans Affairs. And in just 1 week from today, we'll be taking a new position as the Chief of Learning Engineering for the San Francisco VA.
That's amazing. Yeah. You are a Health 2.0 Conference Summer 23 honoree. How does it feel to receive recognition for your accomplishments?
I'm not one that really loves a lot of media attention, so this is new for me, but definitely very humbled and appreciative of my network and the folks that I work with, and obviously the conference for the support. So
Absolutely.
Very appreciative.
Good. What advice would you give to someone wanting to follow in your footsteps?
I usually say don't, and I'm sure that's probably what many of my other colleagues have said, but I don't know. I think back to a lot of my mentors, and there's attributes of their journeys that I really resonated with. And so I think one of the things that I find powerful are people's stories. So I might just encourage people to really get to know your own story and who you are as a person, live your life as authentically as you can, both at work and in your personal life, and try to meld those two worlds together, and you can create a really beautiful career.
Absolutely. How has your learning and networking experience been so far at the Health 2.0 Conference USA?
It's been fantastic. I really didn't know what to expect. Coming in here, I had all kinds of travel problems, and I think I maybe was running on 2 hours of sleep. So after a good night's sleep and meeting some of my fellow panelists, it's just been amazing, the folks that I've been able to connect with. There's so many like-minded individuals. Our opening keynote was fantastic. I took so many notes, and I have so many things to go back to work with and start to implement. But it's really been fantastic. The people that are here care, and we really have a wide gamut of folks from all over the country, which is great.
Absolutely. Where can others reach you for collaboration and advice?
You can contact me. I'm pretty findable on the interwebs these days, but LinkedIn is probably the best way. I'm pretty active on there and like to share all of the different ventures that I'm involved with on LinkedIn.
Perfect. What do you think is the next major focus over the next 5 years within healthcare?
So right now I'm really interested in the U.S. Surgeon General's second pandemic around social isolation. So he speaks about how social isolation is more deadly than smoking a pack of cigarettes a day. As a recreational therapist and a health coach, my whole career has been built around helping people find what matters to them and build healthy lifestyles around recreation and leisure as a coping mechanism. I think the pandemic really exacerbated that for so many of us. It isolated so many people. It created already existing social fissures in the social fabric of our country and really exacerbated that. But I really think that if we focus from a public health approach of how do we connect people to things that matter to them, in this day and age, because of the pandemic, we other each other quite a bit. We don't have these hard, tough conversations with each other when we really have a lot more in common with one another than we do apart. And I am a firm believer, mainly because of my background, that recreational leisure is a conduit for health and healing, social connection, and helps us become a healthier society and community. So I'd like to have 15 minutes with the Surgeon General to talk to him and introduce him to recreational therapy and really just help my fellow citizen embrace using leisure and recreation not only as a coping mechanism, but as a way to connect with their communities and build stronger, healthier communities in our country.
That is so amazing. What opportunities has the healthcare industry missed so far?
I think we're starting to pay more attention. I've been really privileged in the roles that I work with in the VA to work in an integrated system. And on the panel that I'm going to be speaking about with my colleagues, we're focusing on holistic health. And that's been a buzzword for quite some time, but I think the overall industry is starting to move in the direction of really holistic, integrated, whole health, looking not just at prevention and treatment, but really proactive means, and also the social determinants of health are really starting to become less of buzzwords in the industry and more of actionable pieces. So paying attention to those factors of our life that are not just the medicines that we take and the preventative care that we do, but what we eat, who we are, where we spend our time, where we grow up, the impacts of geography and socioeconomic status on our health. I think all these factors are starting to become less of like these hypothetical concepts, and we're starting to see some services outside of my time at VA being set up in some of our communities. So I'm really excited about that and proud of the work that we're doing.
Absolutely. Well, it's been such a pleasure speaking with you today. Thank you for your time.
Thank you too.